Renal and electrolytes quiz.
Which electrolyte imbalance is most likely to potentiate the effects of non-depolarizing neuromuscular blockers? Hyperkalemia, hypokalemia, hyponatremia, hypocalcemia.
Hypokalemia. Hypokalemia hyperpolarizes the motor end plate, making it more difficult to depolarize and thus enhances neuromuscular blockade.
A patient with end-stage renal disease is scheduled for surgery. What is the most appropriate timing for dialysis before elective surgery? Same day, 1 day before surgery, 3 days before surgery. Only post-op dialysis is necessary.
1 day before surgery. Dialysis 24 hours pre-op optimizes volume and electrolyte status while minimizing fluid shifts and hyperkalemia risk.
Which of the following volatile agents preserves renal perfusion best? Halothane, isoflurane, sevoflurane, desflurane.
Sevoflurane. Sevoflurane is associated with better renal perfusion maintenance due to minimal sympathetic stimulation and stable hemodynamics.
Which of the following lab values is most reliable to estimate renal function in the perioperative period? BUN, serum creatinine, estimated GFR, urine output.
Estimated GFR. Estimated GFR is more accurate than serum creatinine alone because it accounts for age, sex, and race.
Which intraoperative fluid is least appropriate in a patient with hyperkalemia? Normal saline, D5W, lactated ringers, plasmolite.
Lactated ringers. Lactated ringers contains potassium around 4 MEq per liter, which can worsen hyperkalemia.
During TURP under spinal anesthesia, a patient becomes confused and hypertensive. Sodium is 118 MEq per liter. What's the likely diagnosis? Hypoglycemia, TURP syndrome, sepsis, acute stroke.
TURP syndrome. Absorption of hypertonic irrigation fluid leads to hyponatremia and volume overload, presenting with neurologic and cardiovascular symptoms.
Which of the following electrolyte abnormalities increases the risk of prolonged QT and torsades de pointes? Hyperkalemia, hypocalcemia, hyponatremia, hypomagnesemia.
Hypocalcemia. Low calcium can prolong the QT interval, increasing the risk of torsades.
What is the safest paralytic for a patient with renal failure requiring rapid sequence induction? Succinylcholine, pancuronium, cisatracurium, vecuronium.
Cisatracurium. Cisatracurium undergoes Hofmann elimination independent of renal or hepatic function, making it ideal in end-stage renal disease.
Intraoperative oliguria is defined as urine output less than 1 milliliter per kilogram per hour, 0.5 milliliters per kilogram per hour, 2 milliliters per kilogram per hour, 30 milliliters per hour.
0.5 milliliters per kilogram per hour. This is the standard definition used to identify renal hypoperfusion or early acute kidney injury, AKI.
What is the first-line intraoperative intervention for treating hyperkalemia with ECG changes? Insulin plus dextrose, calcium chloride, furosemide, sodium bicarbonate.
Calcium chloride. Calcium chloride stabilizes the myocardial membrane and is the immediate treatment for ECG changes, followed by agents that shift potassium intracellularly.